Hello, today Jessica Keller and I will be talking to you about sympathetic and parasympathetic modulators.
The autonomic nervous system automates the body so that certain functions happen without any effort from the mind itself. It regulates smooth muscle, cardiac muscle, and glands, and there are two divisions, the sympathetic nervous system and parasympathetic nervous system. Organs that are innervated by the autonomic nervous system typically have a sympathetic and parasympathetic component, with very few exceptions. The sympathetic nervous system is primarily responsible for preparing the body to handle arousal and events that utilize stored energy. The central nervous system, sympathetic nervous system, plays a critical role in behavioral response to noxious stimuli as it prepares the body to fight or to flee pain. During sympathetic nervous system activation, heart rate, blood pressure, and respirations increase. Blood is shunted to the muscle and away from visceral organs. Pupils dilate, sweating increases, and blood flow to the skin is restricted to limit bleeding. The parasympathetic nervous system, on the other hand, prepares the body to store energy, but also to rest and heal. The sympathetic nervous system stimulates salivation, increases motility of the digestive tract, slows heart rate and respiration, and controls pupil restriction. This chart shows activity of both the parasympathetic and sympathetic divisions. Like we talked earlier, organs that are innervated by the autonomic nervous system typically have a parasympathetic and also a sympathetic component. And this chart just kind of goes to show activity in the eyes. The parasympathetic constricts, the sympathetic dilates pupils, and you can just kind of look down through and see all of the different activities of both the sympathetic and parasympathetic division of the autonomic nervous system. When the sympathetic and parasympathetic nervous systems are working smoothly, the body will easily move in and out of sympathetic and parasympathetic states without hesitation. On occasion, however, the body gets stuck in a sympathetic state. This can cause the brain to change how it responds to the pain, and the way the brain responds to the pain is called a pain signature. When the body experiences stress, either from life events or from trauma, the sympathetic nervous system is activated. Short-term activation of the sympathetic nervous system in healthy subjects suppresses pain. But if for some reason the sympathetic nervous system stays activated and the pain becomes chronic, neuroplasticity will change the physiological reaction of the body to pain. Two studies done by Rudy and Mager in 2002 and Schletherin and Birkin in 2008 suggest that fear and an immediate threat to the body decreases pain perception, but that a state of continued anxiety about a perceived threat in the future or remembering a threat from the past can cause increased pain perception. Also, daily struggle, personal conflict, and social pressures, coupled with depression, anxiety, and anger, can intensify the effects of acute and chronic pain. The feelings of continued anxiety can be classified as a form of stress. Consistently feeling stress in life may produce an increased activation of the sympathetic nervous system, and this activation is referred to as upregulation. What we just gave you was a very brief and surface level overview of the autonomic nervous system and central sensitization. We just wanted you to be able to identify maybe central sensitization in your patients and to think about what upregulation of the sympathetic nervous system would look like. But now that we've kind of gone over that a little bit and have covered some of the, like I said, the highlights, let's look at some sympathetic modulators, something that we can do maybe to help in this situation. This comes from a classification of treatments called energy psychology. We'll be talking to you today a lot about emotional freedom technique or tapping, which derive from thought field therapy. Also, traumatic release exercises, reflexercise, and sensory flow, which is formerly known as reflex. There are a variety of energy psychology techniques, energy healing, emotion coding, reconnective healing, and all of those things are things that we would encourage you to look at, but for the sake of time, we're not going to talk about all those. So without further ado, how about some tapping?
The first treatment that we're going to talk about is emotional freedom technique, or EFT, or tapping. First, you need to understand a little bit about how it responds in the brain. In the brain, we have what's called the amygdala, which is our own personal alarm system, and it's found in the midbrain, and it helps control the limbic system. It's a source of emotions and long-term memory. Negative memories are programmed in this area, and when you experience trauma or fear, the amygdala gets triggered. The body is then flooded with cortisol, which is the stress hormone, and your stress response significantly influences and can sometimes even cause whatever it is that troubles you. For example, illness, injury, or even some kind of external problem, such as your finances or relationship. Also, the amygdala remembers these traumatic experiences for the future, and when something happens, the amygdala says, where there's smoke, there has to be fire, so it gets triggered. The amygdala also triggers the fight or flight response, and it can be triggered externally or internally. With EFT, there are different meridians that we tap on, and it's basis of ancient Chinese medical system of acupuncture. The energy channels that carry the vital life force of the qi. On the next slide, we'll talk about the different meridians and what they're responsible for. Meridians are also associated with different organs, and the endpoints are where we end up tapping, and they help to access the energy channel. These meridians can be manipulated with needles or touched to balance or unblock the energy flow. In EFT, it's a sequence designed to hit all the major meridian points. It helps to halt the fight or flight response. They're not really sure why it works, but when it does work, it helps to send calming response to the amygdala to help the amygdala know that it's safe. And it counteracts stress and reprograms the hippocampus. The tapping also helps to communicate if there's a threat or if they're safe, and reprograms the brain and body to react differently. In the last slide, we talked about different meridians throughout their body and how they each have a function with different organs throughout the body. The small intestine meridian receives and transforms food by separating the pure from the impure. The triple heater meridian is made up of the upper burner, which controls intake, the middle burner that controls transformation, and the lower burner that controls elimination. The large intestine meridian controls the transformation of digestive waste from liquid to solid state and transports the solids outwards. The stomach meridian works in absorption of qi from food. The liver meridian is responsible for filtering, replenishing, and circulation of blood. The spleen meridian is for self-esteem and an open mind. The kidney meridian controls the growth and development of bones and nourishes the marrow. The heart meridian rules the blood in its vessels and directly circulates. The pericardium, which on this chart is misnamed, is the heart's protector and providing physical protection. The lung assists with the circulation of blood. And since breathing also directly controls the autonomic nervous system, it forms a bridge between body and mind. The bladder meridian is the longest and most complex, and the gallbladder meridian is responsible for decision-making and good judgments, as well as providing courage and initiative. EFT was developed by Gary Craig and is based on the research of Dr. Roger Callahan, who came up with a thought field therapy, which is like tapping, or as we know it now, except without the emotional factor involved. Some leading researchers in the area are Dr. Dawson Church and Dr. David Feinstein. And they've done numerous studies on post-traumatic stress disorder, phobias, weight loss, anxiety, fibromyalgia, and depression and headaches, and all found that tapping is a successful and viable method for the treatment. One particular study that I thought was interesting was by Waite and Holder in 2003. They had 4 different groups with 5 categories. A treatment group that did tapping, a placebo group that did tapping on their arm, a model group which did tapping on a doll, no treatment, they just rated their fear and anxiety, and then all groups rated their fear before and after the tapping treatment. Some of the treatments reduced the fears, but they had uneven numbers in their groups, so they found that it was effective, but not more than the placebo or modeling. So they kind of showed that tapping on your arm or tapping on the doll could be just as effective as regular tapping. Here we have the tapping tree, which is very helpful in organizing your thoughts and anxieties and fears that you may want to tap on during a treatment. You can use it to help determine where the issues are and how they are connected and affect us. They go from superficial to deep. The leaves are your current problems or events. The branches are how you feel about those leaves. The trunk is other events in your life that are similar, and the roots are what you believe about yourself based on those events. And you can use each of those to dig deeper and work on each individual problem that you might have that is causing you your stress or anxiety. First, I'm going to discuss how to set up an effective EFT treatment. First, you want to identify the problem you want to focus on. It can be general anxiety, or it can be a specific situation or issue which causes you or your patient to feel anxious. The nice thing about tapping is that you can do it on yourself, or that you can do it for a patient. You can use the tapping tree like we just discussed for guidance. You want to consider the problem or situation and how do you feel about it right now. So you're going to rate the intensity level of your anxiety from 0 to 10 before you start the treatment. Then you're going to compose your setup statement. Your setup statement should acknowledge the problem you want to deal with, and then follow it with an unconditional affirmation of yourself. For example, even though I feel this anxiety, I deeply and completely accept myself. And then you're going to start by performing the setup. With 4 fingers on one hand, you're going to tap the karate chop point on your other hand. The karate chop point is the outer edge of the hand on the opposite side of the thumb. Repeat the setup statement 3 times aloud while simultaneously tapping the karate chop point. Now, I've seen a couple different ways that is done. I don't necessarily think one way is better than another. They're just depending on the script that you use or if you freelance. From this point, you want to remember to use a firm but gentle pressure, as if you were drumming on the side of your desk or testing a melon for ripeness. When you're moving to other tapping points, you want to remember to tap with your fingertips, not your fingernails. The sound will be round and mellow. You can use all 4 fingers or just 2. The tapping order begins at the top and then works their way down. You can return to the top of the head to complete the whole entire cycle. Then you're going to tap 5 to 7 times on each of the remaining 8 points in the following sequence. Now, Dr. Nasipny always talks about using the opposite hand for the opposite side to involve both aspects of the brain, or both sides of the brain. I didn't find anything that said one way or another, but we're going to do opposite side. So first you have the head, the eyebrow, the side of the eye, under the nose, chin, collarbone, under the arm, and then back to the head to complete the sequence. As you tap each point, you want to make sure you repeat a simple reminder phrase such as my anxiety, my interview, or my financial situation. Once you've completed the sequence, you're going to follow your program again, or focus on your problem again. How intense is the anxiety now, and rate it on a scale of 1 to 10. If your anxiety is still higher than a 2, you can do another round of tapping. And you want to keep tapping until the anxiety is gone. You can change the setup statement to take any of your efforts to fix the problem and your desire for continued progress. Once you feel the immediate anxiety has dissipated, you can work on installing some of the positive things. For example, I have faith in my ability to change. Some other helpful tips that I've found, it's helpful to be in a quiet setting when doing this, so having either nobody else in the clinic or going to a quiet room. You want to talk to your patients before, or at least I find that helpful. This is a little bit different kind of treatment, and talking to them and prepping them about what we'll be doing and what they might experience, and see if they're open to it. Sometimes I found doing this with patients, they're not always open to it, and it ends up being more something silly that they're locking through. Ones that are serious, I tend to give them homework and have them fill out the tapping tree, and then when they bring it in, we'll go through, I'll teach them how to do it, and then we'll go through one of their problem areas, but also teach them how to do it on their own, and how to incorporate the tree and freelance on their own. The next treatment that we're going to talk about is the TREs, or Traumatic Releasing Exercises. They were designed by Dr. David Berselli over a 5-year period after observing large populations of traumatized people in 5 war-torn countries of Africa and the Middle East. TREs are a simple technique that uses exercises to release stress or tension from the body that accumulates from everyday circumstances of life, from difficult and traumatic situations. TREs are a set of 7 exercises that help to release deep tension from the body by evoking a self-controlled muscular shaking in the body called neurogenic muscle tremors. The shaking originates deep in the core of the body from the psoas muscle. The psoas muscle is known as the fight or flight muscle, and during a trauma, the psoas muscle contract. They must let go afterwards to return to a relaxed or calm state. But this does not always happen, and ends up causing low back pain. When contracted, the psoas muscle pulls the body forward while the erector spinae pull back, which compresses the lumbar spine and leads to secondary neck and shoulder pain. However, it is not socially acceptable to shake or tremor. This reduces our ability to cope with stress. Neurogenic muscle tremors were first noticed in animals as their built-in way of coping with stress. Weakness is unacceptable in humans, and shaking is considered a weakness. It ends up becoming a fight between the mind and body, and the mind usually wins, this results in muscle tension, and it can become chronic. And it also becomes a continuous loop unless there's some kind of discharge of all this stress. Your body's natural way of discharging high levels of tension during stress is through shaking or tremors. The shaking is their body's way of turning off the alarms. TREs should make you feel exhausted or like you've just had a long workout, and sometimes invigorated or refreshed. It can help reduce blood pressure or evoke strong emotions. It's very good for surface level tension, but not deep. If you have some kind of deep tension from some unresolved issues, it may leave you feeling hopelessness and helplessness if the tensions aren't relieved. And it's helpful to integrate if you have those deep tensions with other psychosomatic work. Even though there's been very little research done on TREs, Dr. Berselli has done a few studies on his own. One such study is the Mindful-Based Trauma Prevention Program, which combines different techniques to help caretakers or practitioners from getting a secondary trauma. Secondary or vicarious trauma refers to an individual's own psycho-emotional reactions due to his or her own exposure to others' traumatic experiences. When individuals engage in trauma-inducing professions for extended periods of time, not only the individuals themselves, but also their institutions or organizations in which they work can develop some kind of trauma-based behaviors. So hearing about certain traumas or having compassion and things like that, you can start to, as a practitioner, experience some of the same trauma that your patients are. The mindfulness-based trauma prevention program contains 3 separate exercises in a sequential order: mindful breathing and body scan, TREs, and then a repetition of the mindful breathing and body scan. Mindfulness is the ability to experience the present moment without judgment. It is developed by John Kabat-Zinn around 1990 and uses several different types of mindfulness practice, including mindfulness of the body, or the body scan, breathing, walking, and eating. A greater awareness of trauma and practicing preventative measures has the potential for protecting all professional caregivers in the cultural reality of trauma and can help provide better care for their patients. In 2009, Berselli looked at evaluating the effects of stress reduction using tremors in a pilot study. The results were inconclusive, with moderately significant outcomes, and they were unable to compare to other studies the outcomes that they did receive, because this was the first study of its kind. They also said to interpret the outcomes cautiously because there were some validity issues. It was a good setup and basis for future research, though, so a lot of good topics for future studies came from it. In 2010, Berselli looked at neurogenic tremors in general and determined that these methods need to be applied to large-scale populations, self-directed, and immediate, and can be used cross-culturally and for different languages and different peoples. TREs, we first need to make sure that the patient is in loose-fitting clothing so they can move around easily, that they don't have shoes on, and plenty of space for them to be able to move and exercise, and then a piece of wall so they can do the wall squat when we get to that exercise. First exercise, you have the patient turn both feet up onto the sides in the same direction. This will cause the patient to stand on the outside of one foot and the inside of the other, and they're going to hold this position for 30 seconds. Then sway their body in the opposite direction and change your feet direction. They're going to continue swaying back and forth like this very slowly, 5 times in each direction. The second exercise is a calf raise. You're going to have the patient put their non-working foot up on the chair, and the other foot is going to come up and down on their toes, raising their heel as high as possible to the floor, 15 to 20 times. It might cause tightness or burning or pain. If it's too intense, then they should stop, but otherwise they continue until they're done. After the 15th one, the patient's then going to hold their heel up in a raised position for about 30 to 60 seconds. After this time, they're going to come to a standing position on both legs, and there might be some shaking at that point in time. After they're done with the one leg, they'll switch to the opposite leg and do the same exercises. Exercise, the patient's going to hold their foot with the same side hand and slowly bend down and touch the ground with their free hand. While touching the ground, they're going to bend their standing knee as deeply as they can and then straighten it. They're going to repeat this process 10 to 15 times, and then they're going to repeat that 5 times each leg. As a modification, if your patient has problems balancing, they're able to use a chair and hold on and do the same thing. The patient's going to stand with their legs spread apart so that there's some tension on the inner leg muscles. They're going to bend forward until they can touch the ground, and they should feel a stretch on the inner thigh and the backs of their legs. Then they're going to walk their hands over to one foot and hold that position for 3 slow, deep breaths. Then walk their hands over to the other foot and hold that position again for 3 deep breaths. Then they're going to walk their hands to the middle and reach as far back between their legs as they can. And hold that again for 3 deep breaths. They might begin to feel some shaking in their legs, and they're encouraged to allow that to happen. After they're done stretching, they're asked to come back to a standing position. Exercise, the patient's going to make 2 fists and place them on the top of their buttocks and push their pelvis slightly forward so that there's gentle bow in the back, and they should feel stretch in the front of their thigh. Then they're going to gently twist from the hips, looking right behind you, or right behind them in one direction. As far as you can go. Keep going. Then turn again from the hips in the opposite direction, looking behind you. And to finish, they'll come back and stand in a normal position. The patient's going to sit with their back against the wall as though they were in a chair underneath them and do a wall sit. This will put stress on their upper leg muscles, or their quads. After a few minutes, they might begin to feel some slight pain, burning, tightness, or shaking in the muscles. If it becomes slightly painful, they're going to move up the wall about 2 more inches, and the quivering may slightly get stronger and the pain will begin to subside. They'll continue doing this and sitting in one position and moving up 2 inches for about 5 minutes. After 5 minutes, the patient will come off the wall and hang over forward, leaving their knees slightly bent while they touch the ground. The quivering will most likely increase, and they'll stay there for about 3 to 4 minutes. Seventh and final exercise, the patient's going to lay with their feet together and their knees relaxed and open as far as possible. They're going to then lift their pelvis off the ground for about 1 minute, keeping to make sure their knees stay open. The patient will then set their pelvis down on the floor and let their knees relax open for 1 minute, and they may begin to feel some shaking or quivering in their knees and legs. After the 2 minutes is up, they're going to close their knees another 2 more inches and allow the shaking to continue. If at any point they become uncomfortable, they'll straighten their legs and relax on the floor, and then go back to the position they were just in. Again, after 2 minutes, they're going to close their knees another 2 inches and allow the shaking to continue. At that point, they'll do this for no more than 15 minutes. To finish the exercise, they will turn the bottoms of their feet on the floor so they are flat, and keep their knees slightly apart, and the shaking will continue. And this will continue down into their pelvis and lower back. To end the exercise, you have the patient slide their feet down so they're laying flat on the floor.
Reflexercise and sensory flow were designed by Ernie Quinlisk and Scott Musgrave. They're loosely based on John Imes's PRRT. They're part of a 6-step process that's called the Associative Awareness Technique, and currently, according to Scott, there is no published research on this technique. Now for reflexercise. Reflexercise is a simple, effective tool providing homeostatic stimulation to the amygdala and autonomic nervous system. This enables directed conditioning of brain plasticity. It uses the principles of reciprocal inhibition to oppose the messages of the startle reflex. So essentially, it places the body in the exact opposite postures that you have during the startle reflex. So in the startle reflex, we clench our jaw to engage the masseters. We make fists, which make us ready to punch. We depress our eyebrows and open our eyes as wide as we possibly can, and that increases our field of vision. We flex our neck and we adduct our upper extremities. We extend our toes and dorsiflex our ankles, and we begin this rapid, shallow breathing. The opposite of all of those things is what we do in reflexercise. So we bite the tongue, spread the fingers wide apart as far as we can. We close our eyes, we hold our arms to the side and turn our head slightly to the side. Curl our toes into the ground with just a little bit of pressure, and then we slow our breathing down and just feel our body relax. Reflexercise is something that can be used by your patients multiple times a day. For breathing, when we talk about slowing their breathing down, I usually give them the in for 4, hold for 2, out for 4, hold for 2 process, and then we do 3 sets of that for one reflexercise treatment. The other reason I like reflexercise a lot is that it can be used for homework. So once I teach it to them in the clinic, then I can send it home with them and let them explore it and figure it out, decide when it feels best for them, and then it kind of gives them something that they have ownership over in a way that they feel like they can kind of down-regulate themselves without any help from me. Sensory flow, which was formerly known as reflex, is another component of AAT, and it just allows for a deeper relaxation. They claim that it puts you in this trance-like state. The AAT definition of sensory flow is that sensory flow is a manual therapy technique that provides sensory input to the amygdala in a safe environment that extinguishes the perpetual arousal state that is the source of chronic pain and physical dysfunction. Sensory flow is a series of touches which stimulate mechanoreceptors, which then send signals to the sympathetic nervous system. So the mechanoreceptors that we're specifically targeting are Ruffini endings, which detect sustained pressure, Meissner's corpuscles, which detect vibration, Pacinian corpuscles, which detect deep pressure and rapid vibration, Merkel's discs, which detect touch and pressure, free nerve endings, which detect touch, pressure, and stretch, muscle spindles, which detect changes in muscle length, and Golgi tendon organs, which detect changes in muscle length. So in sensory flow, we use light touch, vibration, deep pressure, scratching, and tapping in a specific sequence, and that communicates safe sensory stimulation to the amygdala. So that safe input inundates the amygdala and tells it that it's in a safe place and everything is fine. It extinguishes any perceived threats. And the result is neurochemical homeostasis, which produces a profound state of relaxation. This allows the patient to complete the act of escaping the real or perceived threat. And then that just causes everything else to calm down. So let's take a look at the sequencing a little bit. You can see on the screen the chart, and it shows you the light touch, pressure, vibration, scratching, tapping. The facial sweeps are exactly what they seem like. And the shoulder press is just depressing the shoulders for 10 or 15 seconds. That in itself is a really relaxing thing. But then when you get to the upper arm, bilateral upper arm, right arm, hand hold, that's when you start this sequence of light touch, vibration, deep pressure, scratching, and tapping. In the video that follows, we will show you each type of touch and kind of give an explanation of each type so that hopefully this is something that you can begin to incorporate in your practice very soon. All right, so we're going to talk about the 5 different types of touch for sensory flow. This is a technique that you can do over clothing or you can do directly on their skin. I'm going to do these pretty quickly, but this is something that you would do in a more protracted form when you're doing treatment. So the first one is light touch, and what you're going to do is you're just going to caress the patient's arm or leg, depending on which part you're on, and you want it to be kind of unpredictable for them. So you want to just kind of move around to different places and you always want to have one hand on the patient. The next one is the vibration, which is where thumb and finger approximate and just come off the skin at the same place. Again, none of these are hard, they're just kind of a light contact with the skin. The next that we do is deep pressure, and that's just kind of where you squeeze. Again, not hard, just a kind of a moderate amount of pressure. And then and then we do scratching. Again, you want this to just kind of be an unpredictable pattern, nice and flowy and kind of calming for the patient. And then the last one that we do is tapping. Thanks.
Now that we have discussed a few of the modulators, we both have some questions for future research. From a scientific standpoint, how or why does EFT work? Should EFT be included as a part of a pregame warm-up? Do we unconsciously incorporate tapping throughout the day to help us cope with stressful situations? Should TREs be included as a part of a pregame warm-up or at the end of a practice before competition? Should we be pairing modulators together for a more complete treatment of the mind and body?
Other future research questions that we have: what is the optimal dosage for reflexercise and sensory flow? Does sensory flow really affect change to the amygdala, or is it working some other way? Do these techniques work better paired, or are they equally effective individually? What effects do these methods have on perceived overall well-being? And does sensory flow affect acute pain in patients who are considered upregulated? Thanks so much for taking the time to watch our presentation. Our references are on the slides that follow. Thank you.